Hi, welcome to Healthy Living. My name is Amy Bouton. I'm with the St. Tammany Health System Communication and Marketing team. We're here today to talk about men's health because June is Men's Health Month. So my first guest today is Dr. Sunil Purohit. He is a urologist with the Louisiana Healthcare Associates, and he is also a member of our St. Tammany Quality Network. So we want to talk to Dr. Purohit today about some men's health issues and how to prevent those, screen for those, and then what you do if you find them, how you treat those. So thank you so much for joining us today.
Oh, great being here, Amy.
Yeah, thanks. So we were talking a little bit before the show, and we were talking about your your investment in the community. You've been here all of your life.
Yeah, pretty much all my life. Yeah, we came over to Covington, the North Shore area, in 1978. I did part of my grade schooling here back at River Forest Academy. It's Kehoe, France now.
Okay.
Then went to St. Paul's for my high school education. Went off for a few years to Vanderbilt, did my undergraduate studies there, but always knew I wanted to come back to Louisiana, to the North Shore, and so went to LSU School of Medicine for med school, and then hopped over to Tulane for urology.
Okay.
And now I'm back in the North Shore practicing urology.
Okay, and you followed in your father's footsteps when it comes to your clinical studies.
So, exactly. So my father is a general vascular surgeon. He's been practicing in Covington since the time we came here. And so it was always my dream to join him, and whether being a general vascular surgeon or something else, I ended up doing urology. And so we're in the same office. We have a urology side and then the surgery side. So
okay, that's wonderful. Fun. Yeah, and so I know that that's important that you are part of this community. You grew up in this community, and you probably see a lot of people you know and help people that you know.
Absolutely, and watch this community grow. It's been fascinating.
Yeah, so we are going to talk about men's health today because it's an important topic, and Men's Health Month is around the corner. It's in June, and I wanted to bring you in to talk about some of the things that you see in your practice, the most common things that affect men's health from your standpoint as a urologist.
Yeah, so some common men's health issues that we see day to day, the one, prostate cancer, low testosterone, low T is what a lot of people identify it as, erectile dysfunction, and just plain BPH, or benign prostate hyperplasia, enlarged prostate.
Okay, so let's talk about a few of those things. When you talk about benign prostate hyperplasia, is that something that, how does that affect a man's health and their ability to function day to day? And can that lead to something more serious like prostate cancer?
Well, it's not exactly linked to prostate cancer. There's two separate things. The prostate cancer is abnormal cells in the prostate that you have to treat to take care of the cancer part. BPH, or benign prostate hyperplasia, is a very common problem that men have. As you get older, your prostate grows. It starts to impinge on the urethra, which is the tube that drains the urine from your bladder.
Okay.
So as that prostate grows, it's almost like stepping on a garden hose. The flow decreases. So men will lose sleep at night. They'll have trouble emptying their bladder. You get urinary tract infections. You can get bladder stones. I mean, it can really affect your quality of life, and so you really want to catch these things early, because the longer you wait, the more unhealthier your bladder will get.
Right.
And you only have one bladder, so you want to catch it early, and you can treat those problems. Then you'll have a normal voiding or urinating phase for the rest of your life. So you want to catch it early.
How do you catch it early?
So a lot of times I'll have men, when they come in for just routine checks. And so what do? We do a PSA, which is a blood screening test for prostate cancer. We do an exam. We give them a symptom score sheet to fill out, and that really asks them about their frequency to urinate, their urgency, how often getting up at night, how their flow is. And then some flags will pop up if they're circling certain numbers where their symptom score is high. Then you want to proceed with things called a uroflow, where you can actually measure the flow. You can have them come in with a full bladder. They'll urinate in this special machine, and we can kind of see their flow.
Right.
We do a post-void residual, or we check the residual in their bladder after they urinate. It's like a little ultrasound. We can actually measure what's in the bladder after they urinate, and if it's high, then we know there's an issue. And then we can kind of work it up. We can do an ultrasound of the prostate to see the size, do a little cystoscope where we take a look in the urethra, the prostate, the bladder, and then we start talking about treatments, whether it be medical treatment, which we usually start.
Yeah.
And then if those don't work, then we kind of advance it further to minimally invasive surgeries, etc.
Okay, so there's a process and a treatment. What are some red flags that a man would look for on their own? Like, what are some early symptoms that would say, oh my gosh, I need to see someone about this?
Well, a lot of them, the men may not realize it, their partners do, but getting up at night. So some men will, they're always dragging. They're getting up 4 times a night because they're not emptying their bladder. So every hour, hour and a half, they have to get up and urinate, and they're not emptying. They go back to bed, another hour and a half they get up, and then so the partners will realize a lot of times they go, look, the lights are going on, the bathroom switch is, they're hearing the flushes, all that, and so everybody's kind of not doing as well as they should be because of lack of sleep. That's one symptom. During the day, you have men who, I have lawyers who will be in court, and then they're like, look, every, certain amount of time I have to excuse myself. I have to get, and so there's different, the daytime symptoms of frequency, slow flow, straining to urinate, all those play a factor. The nighttime symptoms, so the overall health can get affected, right?
Right.
You're not thinking as good.
Right.
You're tired all the time.
Yeah.
And, then I have men who keep getting urinary tract infections. And, all these things can play a factor.
Okay, and it's not necessarily just aging if you have to get up several times a night. So just remember that. So it's a red flag.
That's right.
So let's talk about prostate cancer. Prostate cancer screenings are important, and tell us why they're important. We know, obviously, but tell us about prostate cancer and what happens when you find it early.
Yeah, so if you find prostate cancer early, and and you can treat it, you can go your whole life without any issues, right? Now, there's different types of prostate cancer. We always screen patients after age of 50. We do the PSA that I was talking about, the blood test, and then also an exam. And suppose we do have an elevated PSA, now we have options like imaging studies, like an MRI of the prostate. It's more specific for the prostate. It looks at the deep down tissue in the prostate, and if there's any abnormal lesions, then we can do what we call a urinav MRI fusion biopsy.
Okay.
That's done at St. Tammany. We have the equipment, the technology. The hospital was very, agreeable early on when all this technology came out to get this, to offer it to the community, and it's made a big difference. So we can catch these things early. If patients come in for their routine screening, it should be a no issue.
Right.
Now, the last thing I like to see is when a patient who's otherwise healthy comes in with back pain, say, and his primary care ended up doing a PSA, and he's got a very high PSA. And then we do a workup, and guess what? The prostate cancer is spread to his bones, his skeletal muscle. I mean, the skeletal bones in a lower back or what have you. Then that becomes a difficult issue. I mean, you could be a healthy person, 60 years old, even in your 50s, and next thing you know, you got metastatic prostate cancer. So we're trying to avoid that.
Right.
And I think if people go for the screenings, I think most of that can get alleviated before it even starts. You can kind of catch it early.
Yeah. Well, we're going to let you go in just a minute, but I wanted to ask you one question. We talk about men's health, and we talked about this also. We think of older men. What do you want to say to the young men about their health now, 20s, 30s, 40s? What should they be doing to protect their health?
I think, for urology, most of the issues that we have are as you hit the 40 plus years of your life. But, I have patients with urinary tract issues where they get infections. It could be something as simple as a stricture in the urethra. I think people just need to pay attention to how they're voiding, how they're urinating, what their symptoms as far as that goes, make sure that their flow is good, make sure that if you have a family history of prostate cancer, at least get a baseline PSA and an exam at age 40. those are the things. Just be aware of your body. I think that's a big part of it for the younger years.
Okay, well, thank you so much for joining us. We appreciate you being here, and thanks for all this wealth of information. We appreciate that as well. Again, you can find Dr. Purohit at Louisiana Healthcare Associates. So if you need any screenings, if you are having any early symptoms, please get in touch with Dr. Purohit, and we will be right back.